The recording's going. There we go. Hello to all of the attendees, and thank you for attending the SAGE Applied Research webinar series. Before I get started, an announcement on Spanish language interpretation from our partner Angelina at Full Circle Interpreting.
Thank you so much, Andy, and welcome to everybody. Yes, we are going to be offering interpretation services into Spanish for today's session. And so I'm going to explain in Spanish in a moment how to connect to this interpretation service. Thank you so much for your patience. Hola, bienvenidos a todos. Estamos ofreciendo servicios de interpretación para esta sesión. Si usted prefiere escuchar la sesión en español, por favor vaya a sus controles de Zoom, escoja el símbolo redondo de un mundo y váyase para español. En un teléfono o una tableta, esta opción está ubicado abajo a mano derecha. Encontrará 3 puntitos que puede presionar. Eso le va a abrir más opciones. Ahí va a encontrar la palabra interpretación o interpretation. Le presiona ahí, luego se va para español y luego el botón de done o finalizar. Gracias. Cualquier pregunta que tengan o problemas con la interpretación nos dejan saber en el chat y espero que tengan una gran sesión. Thank you, Andy. I've made the announcement and I will post this in the chat as well in case that's more useful for folks, and I hope you have a great session.
Thank you so much, Angelina. Today, we are excited to learn from Dr. Anna Scheyett at the University of Georgia. Dr. Scheyett will be presenting Sowing Support, Folding Stress Management Awareness into Agricultural Spaces. This is wonderful information for thinking about outreach and engagement on this important topic. Before I turn the discussion over, I ask that we all speak in an intentional cadence to permit the interpreters to follow along with the conversation. Also, audience, please place your questions in the Q&A function that you will find at the bottom bar in Zoom. We will follow the presentation with time for Q&A. Now, over to you, Dr. Scheyett.
Thank you so much. Let me begin by sharing my screen. And I am very excited to be here today talking about the work that we've been doing here in Georgia with farmer and farm stress. The first thing that I would like to do, oops, I'm sorry, there we go. First thing I'd like to do is tip my hat to my colleagues at our initiative, Rural Georgia Growing Stronger. We are an interdisciplinary group that has been working in this space for about 5 years, and it's been a great team effort. So, I'm sorry, I'm having a little technology problem here. There we go. Today, really what I'd like to do is tell you a story. I'd like to tell you the story about how we've developed this model that we're thinking of as an infusion strategy when we're working with farmers and farm families under stress. So kind of how did we get here, and some of the principles that we've learned. Part of what I am going to talk about next, because that's how we got into this work, has to do with suicide. And that's a really hard topic. So I'd ask us all to take a breath before I go into this topic. Take care of yourself, do what you need to do. If you need to turn the sound off or just wait a couple minutes and then come back, that's fine. Everybody take care of yourself, because we're all, one way or another, directly or indirectly, have been impacted by suicide. And that's how it all began for this group. Back in 2017 or so, there was a CDC study that came out that showed that farmers had the 3rd highest suicide rate of any occupation, and that the numbers in Georgia were even worse. And the dean of the College of Agriculture asked me, because I'm a social worker by training, a psychiatric social worker, what's going on? And I said, I have no idea, but let's work to figure it out. And that's how our collaboration began. And we began by working with a data set that the CDC has. And it's got a terrible name, but it's a really useful data set. It's the Violent Death Reporting System. and it keeps track of all deaths by homicide, by suicide, and by lethal force in the country, with hundreds of variables. And the ones that were most interesting to me were it had narrative summaries of the police report and the medical examiner report. So you got this little snapshot of what was happening at the time of the person's death. So we were able to pull out all the cases where the person was in agriculture, not agribusiness, but agricultural work in a farm, all of the suicides in Georgia, look at the quantitative data to see what was there, and then do a thematic analysis of those reports that I mentioned earlier. So here's what we found. Overall, the people who died by suicide were male, white, non-Hispanic, more likely than not to not be married, a high school degree or lower, and in their 50s. Not that different than the demographics of farmers in general in Georgia. But this is who we found. The means of suicide, the only reason I put this there is because of the number one means of suicide being gunshot wounds. Now, I am not fighting with anybody's Second Amendment rights, but I think we need to realize that in agricultural settings, there are a lot of guns. And if people are at risk of suicide and having suicidal thoughts, it's really important to think about how to keep people safe. And how do you separate a gun from a person just for the time that they're in a really bad spot? Or how do you separate bullets from guns? What do you do for gun safety? That's an important conversation that we need to have in order to save lives. When I looked at what was going on in terms of the narratives and what were the factors that were associated with the time of the suicide, these are the things that I found. Number one was relationship problems, which is what is seen in all suicide situations. That seems to be the number one associated factor. But close behind it was health problems. For farmers, having a health issue and not being able to work when that's so much of your identity, and being afraid that you're going to be a burden on your family, seem to be associated with suicide. Mental health problems were noted. And when I say mental health problems, I don't mean that somebody went to see a counselor. I just mean that people had said he was seeming depressed. He'd been struggling with anxiety, that there were mental health challenges that had been noted. And then finally, and I was surprised that this was low as it was finances. One of the things I think it's important for us all to remember is that many of those health problems may have had a financial underpinning. We know that farmers are notoriously and underinsured, so the financial burden of health problems could have also been a complicating factor. And we noticed that in a number of cases, the people who were telling the story of the individual who had died talked about signs and hints of suicide that with 2020 hindsight, they had recognized. Things like a woman said, "My father showed me where he kept his insurance papers." Someone else gave away a watch. The one that kind of always haunts me is one gentleman, the last thing he did was he called and he left a voicemail for his neighbor. And all it said was, "My wallet's on the mantle, and would you please look out for my cows?" So there were signs, which this is very tragic and sad, but those signs mean that those are places for intervention. So those are points of hope. Now, the data that I had looked at initially only went through 2017. So the question, of course, that we've had ever since then is, are things changing? What's going on? And we're really fortunate that colleagues at Mercer University did a really big survey of farmers in Georgia. I think their N was like 1,600, and depending on the subset, they always had at least 500 data points. And here were the most common health issues farmers reported. After arthritis, they were all stress-related: anxiety, depression, and high blood pressure. So we're still seeing these huge stressors today. They were asked what they worry about the most. And these are the things that if you talk to farmers, you hear about retirement, work-life balance, changes to agricultural policies, financial burdens. But the one that I think is really interesting is the last one on the list: alcohol use. That was noted as a coping strategy a number of times, and a number of the farmers were concerned about it. We asked if people had had thoughts of wanting to die, and among the farmers, almost 12% said that they thought about taking their life at least once a month. 8% said once a week, and nearly 2% said daily. And when you broke it out and you looked at the first generation farmers, the people who are just starting the farm, 9% of these people said they reported thinking about suicide daily. So we've got an incredibly high risk group within a high risk group there that we need to be reaching out to. And so, as I said before, all of this is very sad and kind of grim, but for me, they're real hopeful implications, because if in our communities we can have people that recognize the signs and symptoms of farmers at high risk of suicide and care, and particularly have them at the points of sort of highest stress. I think of them as points of leverage. For example, primary care physicians, because of all of the health challenges being linked with suicidal risk. Relationships and loss were particularly closely tied. So faith leaders, divorce lawyers, assisted living facilities, several people, suicide followed soon after a spouse had to be put in a nursing home. Financial stressors, and I'll talk a little bit more about that later. Other farmers who they trust. We can intervene before a crisis occurs. So this is really useful and I think hopeful information. But before getting to that really difficult crisis point, we know stress can very often be managed. So upstream education and intervention around stress management are really important when you're thinking about farmers and farm families. Because it's complicated. I put this graphic together to show all of the factors that impinge on farmers' stress. Everything from debts to commodity prices to disrupted supply chains to rural norms and the agrarian imperative. The war on Ukraine was disastrous for farmers because of diesel costs, the lack of providers, the guilt of the multi-generational farm and not being the one to lose it. This is complicated. There's all of those factors, all of those causes, and then they are manifested in a number of different ways. We've talked about overt behavioral health issues, people who experience depression and anxiety. There's also accidents and injuries. When people are under a great deal of stress, they're not as focused. The risk for accident and injuries increases in a profession that is already one of the most dangerous when it comes to accidents and injuries. High blood pressure and cardiovascular disease are very common and stress-related, as well as respiratory disease. And then this is all embedded within the culture and the context of rural agricultural communities, where stoicism and independence are really highly valued. People are supposed to take care of themselves and be in charge of their farm and handle everything and problem solve. And they don't need to ask for help from other people. There's a real stigma in help seeking. And even if someone got to the point of wanting to seek help, we know that in rural communities, the services are so limited. They're very underserved areas when it comes to any kind of behavioral health service. And we have a culture quite frequently in rural communities of we take care of our own. We don't go outside to ask for help. We take care of our own. So we end up with something in addition to the challenges and all the stresses of farming from those little circles that you just saw, that I like to think of as the control conundrum. We have a group of individuals, farmers, independent, strong. I'm going to solve my own problems. I'm going to be in control of my farm. I'm in charge of everything. In a profession where almost everything that has to do with their success is out of their control. And that friction between their sense of responsibility to having to be in control and the fact that they don't control commodity prices or input costs or whether you can find labor or any of those things creates a huge amount of tension in addition to the stresses of the job itself. So this gets really complicated. So our question became, how do we build interventions for farmers and farm families that are accessible, effective, and acceptable to farmers, grounded in a relational approach? Because we knew that if there was not a relationship being built, no one was going to be listening to us. So we started by asking the question, who do farmers trust? Because those are the people who we're going to need to work with to get the message out. And so we did a survey of farmers and farmer adjacent people at the Sunbelt Ag Expo. Who will a farmer trust and talk with when they're experiencing extreme stress? And we found that spouse was number one by far. Over 70% of people said spouse, followed by friends and other farmers, and then doctors and faith leaders. These are the people that farmers are telling us they trust. Please note, middle-aged academic from Athens, Georgia is not on that list. I knew it couldn't be me delivering the message. We need to be working with these trusted others. So we went to talk to some of the trusted others, and we began with spouses. So we did a series of focus groups with farmer spouses in South Georgia. We did 6 focus groups, and we talked to almost 30 women. And we asked about stress in their farmer, in their children, in themselves, asked about their coping strategies, and asked what they thought effective and acceptable messaging would be for farmers. And the themes that we heard, farmers, yes, absolutely high stress. They're reluctant to admit it, but they want to support other farmers. So if you have a conversation with a farmer and it's about these are ways to support other farmers, because you know there are farmers out there hurting, they're much more likely to listen. They also talked a lot about stress in the children and how difficult it was for children being sometimes the only kid in their class who's a farm kid, and everyone else gets to go to the sleepover, but they got to go pull pigweed Saturday morning, and all of those different challenges for children. And then the stress in themselves, and farm spouses have huge amounts of stress. They talked about having a number of different roles that conflicted and that were overwhelming, that their job was everything except for farming. But then they also talked about farming. But their job is to clear the space so the farmer can farm, but then they also help the farmer. They do a lot of emotional labor. They talked about uplifting the farmer during stressful times and being the buffer in the family, particularly between adult children and farmers who are farming together. They talked about being very isolated, and that they were concerned because they didn't know enough about mental health to know what to look for, what to do, when is stress too much, what are the warning signs? I need this information. They did talk about coping mechanisms that they use. Faith is hugely important. Other family members are really important, friends, and this tremendous pride that they had in farming. Farming is a great life. and we're raising our kids out in the country, and we're giving them these good work ethic values. And they were really proud of that. In fact, the title of the report that we did was a quote from one of them, which I asked their permission, and they said, yep, that's the perfect title. It's called "It's a Great Life If You Can Stand It." And the final thing that we heard over and over and over again is time is the most precious commodity. You are not going to get a farmer to give you more time unless he can see that he or she can see it's very important, because time is the most precious commodity. So here we have this information. Who do farmers trust? We're starting to get some insight into what would be acceptable, what kind of messaging we should have. But we knew, I'm really fortunate, I'm embedded within an agricultural communications department. And so we knew that whatever messaging we had is going to have to be grounded in farmers' values. If we're not using the language of their values, they're not going to listen. So we developed from these focus groups and a number of conversations, we developed this really long list of potential values. At the next Sunbelt Ag Expo, we asked people to rank and pick the top 3 for farmers. And this is what came out. Family, faith, farming is for generations, time is precious, and you're supposed to support other farmers. Those really were the most important. So from all of this, we kind of pulled together for our interventions what we learned. That it's real important that we're honest about what the barriers are, particularly time demands and cultural stigma for help seeking. That we know that messages have to be acceptable. And the wife suggested that if you just framed it as part of health rather than talking about mental health, that would be a lot easier for people to hear, and grounding them in farmer values, that the information has to be really brief, really clear, and all over the place. It's got to be omnipresent everywhere they turn around to normalize it. That an important thing to emphasize in the message was that you're not the only one that's feeling this stress. You're not alone. And even if you're in a good space right now, you need this information because you could help another farmer. And the information had to include, how do you access services? And it had to come through trusted others. Like I said, it couldn't come from some academic up in the university town. So this is what we learned. And then we started creating messages. And what we did is we took the highest values that the farmers identified: faith, family, farming is for generations. And we created verbal messages, a number of different ones, about stress management, using some of those themes. And we selected images that we thought captured those themes as well. And we went to the Southern Regional Fruit and Vegetable Conference, and we laid it all out, and we asked growers to tell us, what images speak to you? Which of these messages or combinations of pieces of it do you think are most effective? What's going to connect with farmers? And these are what we ended up developing with their feedback. Take care of your family, take care of your farm, take care of yourself, with some multi-generational pictures, and normalizing the idea of stress. We all know that stress is part of farming, but high stress can make it difficult to stay focused on what matters: your family, your farm, your community. And then they had said they wanted an acronym. So we came up with SAFER. They said an acronym is going to be much easier to help us remember. So how do you combat stress and stay safer? You get a good night's sleep, you're aware of your stress, you focus on things to be grateful for, you eat well and drink lots of water, and you reach out to others. We've gotten really good feedback from that, and we have it as cards, we have it as posters, we have it as flyers, and it is omnipresent in safe spaces. We take it to commodity conferences, field days, trainings, expos. We're giving it to agribusiness, all over the place. We are trying to share this. And we're thinking about more and more about how we frame the conversations. And I put there the witch story because I was at one of these conferences and I was talking about stress. I had a little workshop on it, and a grower came up to me afterwards and said, "Anna, are you a witch?" I'm like, "Excuse me?" Because unless you're a witch and you can control the weather, you can't do anything about my stress. Oh, okay. So making clear the difference between a stressor, which we can't control input prices, and stress, which is what it does to your body, and that we can teach people things that you can do so that the stress doesn't kill you and so it doesn't grind your body down. But thinking about framing it, the first year I went to Southern Regional Fruit and Vegetable, I did a talk on stress. I had 12, 15 people show up. The next year, at the suggestion of one of the leaders of the conference, we called the talk "The New Competitive Advantage, Mental Clarity." And it was the same talk about stress. But I had over 50 people in the room because it made sense to a farmer that this was something that would benefit them. So the next thing that we wanted to do, because the wives particularly had really asked for this, was resources for trusted others. And we've developed, and it's just about ready to come out, resources for farmers under stress and people who care about them. It's a 32-page booklet that compiles from the best that's out there all over other extension and research and the American Farm Bureau and everywhere. This information: what's stress, what are signs of high stress, how do you manage stress, how do you help a farmer who's under stress, what about suicide, what about substance use, and lots of additional resources. It will be on our website come May, as soon as it finishes the last iterations of editing, but we're really excited about that. And we're collaborating with these trusted others around this, getting the resource booklet to wives. We're training extension agents, particularly agriculture and natural resource agents, the farm agents, on farm stress. Some have gone through question, persuade, refer, or mental health first aid. And in some communities, other community leaders are asking for this training also. And then we developed another intervention that we call the Farm Stress Production Meeting. And we're really excited about this because this is one of those infused kinds of things, like having stuff at all of the different events that I mentioned before, that seems to be getting the message across. And production meetings at Extension, for those of you who aren't part of Extension, the beginning of the year before planting, extension specialists will come to a county and they'll, in a commodity specific way, talk about, here's what we've learned about new varieties of cotton and fungicide and pesticides, and it's all the hot information. And the extension office has a meeting. It's usually around a meal. They get between 30 and 80 farmers will show up and they'll talk for an hour. So we did a couple of things. One is, in the middle of the packet of information that they had, we slid our information about mental health and stress management so that people could take it and nobody could see whether they picked it up or not. We had a local nurse in the back of the room doing blood pressures, checking blood pressures for free, and then talking about the links between stress and blood pressure. And then we had one of our team members, the one who's done it the most, grew up on a Georgia farm, and people would know her daddy half the time. And she would just come up and say, "I'm going to talk to you about stress for about 5 minutes. What are the things that are stressing you out these days? What do you do when you have a lot of stress?" And there was a lot of talk about prayer and a lot of talk about tequila. But what are some other things you could do? What's good stress? What's bad stress? What are things that really are not good to do when you're under a lot of stress? And she just broke the ice and got the conversation going and got people thinking about it in a really relaxed and normalized way. We've done this in, it says 10 there, I think by now we're in 15 counties in Southwest Georgia, which is our big agricultural area. And we've done a pre-post survey, just looking at, are we nudging attitudes and changing them a little bit. And we use the stages of change model to measure that. And then we also interviewed the extension agents in that county who are just in the back of the room, kind of watching all of this and then talking to these growers in subsequent months. And what we found was that we actually are nudging attitudes forward, where before, here, I'm sorry, I'm looking over my screen here. Only a few farmers were saying that they 15% actively use coping strategies to manage their stress. After hearing the speaker, we had almost 30% saying, yeah, I'm committed to doing this. I'm committed to actively using coping strategies. And we actually got a statistically significant shift. We also, from the agents, heard about shifts. That prior to the farm stress production meeting, these guys weren't talking about stress. They might talk about stressors and complain about the price of diesel, but they weren't talking about their stress. That the agents saw that during the conversation with our staff member, that the farmers warmed to the topic and they really got increasingly comfortable and participated in it. And that afterwards, the agents saw farmers being more open about the conversation. Some of them reported, yeah, I got a call from one of my growers a week later going, what that little girl said over there about stress, that's really true. That really gets to you sometimes. And I'm really having a hard time right now. Another agent reported that she was in the grocery store and some of the growers' wives would come up to her and go, I think it's great that you're talking to them about stress and mental health. They need to hear this so much. So clearly their husbands had got home and had talked to the wife about it. The agents also talked about the impact on them and how this gave them an increased understanding of stress and made them more comfortable with the topic and made them want to check in on their growers and see how they were going. And the last thing they said was, oh my God, we need so much more of this. They need the education for themselves, for farmers, for trusted others to keep this conversation going. This was tremendously important. So we have a lot of demand for this now. One of our big challenges is that Georgia's got 159 counties, and there's not a lot of us. And production meetings happen January, February. So we're trying to get as many as we can, but we've got to move to a train the trainer model. We've got to get agents comfortable enough to be able to do this themselves. And if you're interested in sort of the whole article on that, the link is at the bottom there. So that's some of the stuff we've been doing. What are we working on now? Ongoing infusion. We're trying to find places, as many places as possible that are accessible and acceptable. Where are farmers already? The people told us over and over again, you're not going to do a program on mental health and have farmers show up, maybe a wife or two, but you're not going to have any producers show up. You needs to be in things where they already are. So as I said before, we're going to every commodity meeting we can. When Extension has field days, we're there. We've been talking to some of the agribusiness people. We've been talking to financial entities. So we're trying to get the information out there through various forms. We're continuing the farm stress production meetings. As I said, they're a little challenging logistically, but we're going to move to, I think, a train the trainer model and keep moving forward with those. A lot of the extension agents have asked for additional training in this area, and they are trusted others. So we've done things like in our extension training, I have a training on barber stress and suicide. I have a training that's called What is Behavioral Health and Why Should Extension Care About It? Just to get the language and the conversations and the basic information out there. And it's been real well received by the extension agents. One of the things that we've done and need to continue doing is ongoing outreach with women, both women who are spouses. They are were very vocal about needing support from each other and feeling very isolated. And also women farmers. We've done a little bit, some interviews with women who are themselves producers, who have a whole different kind of isolation and a different kind of stress. So we need to be doing more there. And then recently I had an epiphany. I had a realization. And so we've got this, I call it a nascent initiative. It's the beginning of something. And you're going to think I'm silly and you're going to go, duh. But it came to me when I saw a cartoon that looked like this. This isn't it because I can't find it, but this is the idea. This poor little person's here and his house is on fire and he's totally distraught. And this other person next to him, who kind of looks like an academic, is going, now remember, do your relaxation exercises like I taught you, while the person's house is burning down. And I saw that and it was kind of a gut punch because it's like, wait, I'm teaching drink enough water and breathe deeply, and people's houses financially are burning down. This is a really stressful time financially. You know, the financial projection from the USDA that came out this year is like 17% losses, 20% loss. It's not good. So we can't just be talking about stress management. We've got to respect and acknowledge the lived reality of farmers who day to day are trying to keep their farms afloat. So what we did, my reply for everything first is to get some information, is that we did another survey of growers. And we just said finances are stressful for everybody. If we were to provide you with more information on finances, what would be the things you would want the most? And that would help you reduce your stress. And so we had a whole big list and everything was important. 60% of the people said everything would be very helpful, but the things that floated to the top were understanding government programs, because government programs can be Byzantine. And people wanted to know about disaster and also just about financial programs. So we started trying to figure out how to infuse stress content in context where financial stressors happen. And we're very fortunate in Georgia that the Farm Service Agency is led by this great guy named Arthur Tripp, who used to work at the university and who was really open to partnering with us. So I was able to do a training for all of his county leaders on farm stress and ways to be supportive. All of our materials are going out to the Farm Service Agency, to the FSA offices. So they're there. They can have a poster on the corkboard. They can have a stack of cards, you know, by the desk. Again, trying to normalize it. And in the place, and for those of you who may not know, FSA is the lender of last resort in agriculture. So if a farmer's there, it's really, really bad. So this is a very, very stressful time. And they've also given us some of their information. They have a great booklet that's like a summary of all their programs. And there's the links to some of their flyers and some of their booklets. And we're starting to put that in our materials too. So we're really trying to cross-pollinate. And the next step, and I just got them to agree to this about a week ago, is that when they do their farm loan workshops, I've been there in the past at a table handing things out. They're going to let me talk. They're going to let me do a version of the farm stress production meeting model, but for financial stress. So I've been talking a whole bunch, take home messages from me, from our experience, that messages for farmers under stress need to be value syntonic. They have to resonate with their values. They have to connect to a perceived need. They've got to be simple. They've got to be everywhere. And they have to be in spaces where farmers already are. We need trusted others as allies. We need the wives, we need the extension agents, we need the pastors, we need the primary care physicians, and we need to just normalize these conversations and open the door and invite people in. And I find that once you do that, people really want to talk. but you've got to create the right conditions for that to happen. Okay, the last thing I'm doing is a shameless plug. We have a blog that comes out weekly called Thriving on the Farm. And the idea is, because people have no time, it's things you can read in 3 minutes, and it's got tips and supports for managing stress on the farm. And anything that's suggested that you do, you can do in 5 to 10 minutes. A lot of it is while you're sitting at a red light, you could do blah, blah, blah. So if anyone's interested, you're welcome to sign up for that. And like I said, it comes out mostly every Monday. And with that, I will say thank you. And I'm finished, and I will hand it back to Andy in case there are questions.
Yes, thank you so much. That was an incredibly informative presentation. There is a question from an individual, Omar, who arrived after you had gone over this piece, but so just to help this audience member in terms of the stressors that farmers are confronting, and specifically Omar asked about how farmers are discussing climate and operational challenges.
Okay, so sort of an overview of the major stresses they're experiencing, and particularly climate. I actually have a colleague who's doing research on the impact of dramatic weather changes, which is what he calls climate changes, on farmer mental health, which is really interesting. Overall, the biggest stresses that we're hearing from farmers now are all the things they don't have control over. So it is input prices, and input prices have skyrocketed with inflation. Commodity prices, where we are, cotton is a big deal. Cotton's at 79 cents a pound now, which is horrible. Labor is a huge issue, both being able to afford H-2A workers and just being able to find labor is a huge issue. Understanding the, Byzantine processes of the federal government and what you have to do to apply for assistance is huge. Isolation. This job is hard on your body. All of those things are big stressors. And as the weather changes, and farmers will acknowledge that we are seeing more dramatic fluctuations in weather, the risk is higher for them. There's more drought. And then when there's rain, there's 5 inches of rain at once. And we've had a number of hurricanes come through Georgia, and there were tornadoes and hailstorms last week, and it seems to be getting more dramatic. And so those are some of the big ones. I'm not sure if that answered the whole question, but those are some of the big ones that I can think of. Does that help?
That helps a lot. And I think that H-2A and that labor question comes up in a lot of spaces also because, with rural depopulation, I wonder if this has come up in your conversations. With rural depopulation, there isn't always a pool of individuals there to access.
Yeah, it's huge. I mean, we hear a lot in South Georgia about people having to use H-2A worker brokers and having to pay them, who then bring people over from South and Central America. And how challenging that can be. And I did have a conversation with a blueberry grower year before last, who said there were some fields he just left to rot. There just was nobody to pick it. So it really is a huge challenge.
I have a question in terms of the process you went through to develop relationships with extension agents and bringing them into this mental health conversation, and if there was initial pushback, or was it about kind of just building that trust over time? Like how did that go about?
Sure. And that really got initiated by the district director in Southwest Georgia Extension. And she pulled together a group of people. She was brilliant, Andrea Scarrow. And she pulled together a meeting, and it had local extension agents from kind of those counties. It had somebody from the local hospital, it had a pastor, it had people from Chamber of Commerce. I was there. And we all just were talking about this, and we started talking about the challenge, and people talked about seeing the stressors and not quite knowing what to do. And the agents were the one who were adamant, we are not doing programs on mental health. No one's going to come. Nobody wants to hear this. This isn't going to work. You're going to have to sneak it in. So Jeremy Kickler, one of the agent in Colquitt County, invited us to a production meeting. That's how that whole thing came out, because the agents were like, no, we're not doing these specialized things. And we did get pushback. I mean, there were some agents who are like, I don't want to talk about this. I'm not a therapist. I'm not trained in this. And so we had to do a lot of talking about, of course you're not, we're not expecting you to be. We just want you to be able to say, you know, hey man, are you doing okay? If they're not, to be able to give them some resources. And if they're really not, to know to call and get some help. Oh, and one thing I didn't say, and I'm assuming everybody on this call knows it, but if they don't, everywhere I go, I chant 988, because that number, the 911 for mental health, is everywhere in this country, but it hooks up locally and it will get somebody help if they need it. So yeah, so there's been pushback over time. As the agents have seen the growers responding, the pushback's gotten less.
Thank you for that response.
Sure.
Omar had a follow-up in the chat around that question of the financial health of the farm, and was wondering if you had seen in your data or in your discussions at producer meetings a linkage of financial health and technology as a part of this stressor. This may be in reference to climate smart technologies or precision agriculture, but that increasing input cost from machinery maybe?
That's a really good point. And yeah, we hear a lot about the increasing cost of equipment because of the technology. As you know, tractors look like computer terminals now, and everything is going more and more high tech. It's really expensive. And we've heard that a couple of different ways, just in general. But we also hear a lot, I don't know how anybody gets into farming anymore. How in the world do you afford the upfront costs if you don't, you know, if your dad didn't have a farm and you don't have something to start from? And we're pretty convinced that that's a piece of why there was such high stress and the suicidal ideation we're seeing in the first gen farmers, because they're buying all this stuff. They're starting from scratch, and that's hugely stressful. So yeah, the cost of the technology is one piece. There's also this whole other thing about how with high technology equipment, you can't repair it yourself anymore. You used to be able to fix your tractor when it broke down. Now you have to call John Deere and wait for the technician to come out. And meanwhile, while you're waiting, the clouds are rolling in and it's about to rain and you're trying to harvest, but you got to wait for the John Deere technician. And if you do try to do something yourself, it'll invalidate your warranty. And in some cases, if you haven't paid it off, they can even take it back. Is what I've been told. But I do know for sure it'll invalidate your warranty. So farmers who, again, want to problem solve, want to fix, can't with this technology. And I think that's another big piece of the stress too. It's expensive and you can't fix it.
We have one last question in the chat, and this is from Shuang Li. They were asking if you find differences among elderly farmers in terms of mental health, and maybe we could expand that, like differentiation across age in terms of farmer mental health.
That's a really good question. And I think we need to remember that in general, when you're thinking about, I'm just thinking about suicide right now, about the highest risk groups, older white men are among the highest risk groups. And that's where a lot of older farmers are falling in that demographic as well, particularly in Georgia. I don't know necessarily the demographics in other states. So you've got them being part of a demographic that's at higher risk for suicide and mental health challenges. Elderly farmers have some additional stressors, older farmers that I didn't mention, which I think impacts their mental health. One is succession planning. Fewer and fewer of their children want the farm. So what are they going to do? I mean, I know somebody who's 80 and he's still working his farm because there's nobody else, and he doesn't want to sell it to somebody who's not going to use it as a farm. He doesn't want to sell it, period, but definitely not to someone who's not going to keep farming on it. So there's succession planning. There's retirement when you didn't really have the opportunity to have a retirement plan. There's a lot of family dynamics when, as the elder patriarch, you have certain expectations. But, you know, I hear people talk about, oh, yeah, my son is helping me out. Well, my son is 63 years old and he's still not an independent person on the farm. He's still helping dad. So all those tense family dynamics happen. So there's all of that with elderly. And then I have a colleague who's actually got a whole project where she's doing dementia screenings in rural areas because that is so under-identified. And that's not specific to farmers, but to older people in rural areas where they may not have their cognitive issues identified and they may not be able to get the supports that they need with that. The other thing, I just found this out, and it's not mental health, but I'm fascinated by it. That survey I showed you about finances and what would help and what wouldn't, I split it out by age. And if you look at who said yes, this information on retirement or insurance or whatever, that whole list would help versus those who said it wouldn't, the ones who said it wouldn't help are significantly older. Like the older people are saying, information on this stuff isn't what I need to deal with my stress. And I literally ran that analysis today. So I'm like, whoa, what's happening here? We've got to talk to these older people. I mean, it could be, I know about all these programs. They're just not enough. They're not what I need. But I don't know. I have to go out and find that out. But there's definitely older people are going, yeah, that information's not necessarily real helpful to me. And the difference was like mid 50s versus 40s and under, was an interesting split. So that's probably more than you wanted to know about older farmers, but I think there are some very unique needs in that population. Other questions?
I think that was all of the questions. Just one last comment from Mike McGurr. Wonderfully informative presentation. Others saying thank you so much, and I will echo that. I really appreciate your time today and sharing all of this knowledge and wisdom you've gained from your studies and also your grounded work with farmers and ranchers. It's important, especially considering what you shared at the beginning, right? The beginning with that CDC study that showed, this is a population at risk that is vulnerable, and before we came onto the webinar, it deserves our support because there's no social system without food. And so a demonstration of that value. So thank you so much, Dr. Scheyett. Really appreciate that today.
Thank you. And I don't know whether you all typically share slides or not, but I'm more than happy to share these, either if you all do that, or if not, to email me, and I'm happy to send you anything that I talked about.
Okay, yeah. Oh, what were you going to say?
I was just going to say, I'll if I can get my computer to work. There we go. I'll put my email in the chat. And I interrupted you. I'm sorry.
No, you're fine. I was going to say I have the registration list as well, and I can share out the slides to everyone that registered.
Awesome. Thank you so much. And thanks so much for the invitation, and thanks everybody for participating.
All right, y'all. Well, everybody have a great weekend and look out for future webinars from the Southern Ag Exchange Network. Bye for now.
Take care. Bye-bye.